Do you get recurrent low iron every time you go and get your blood test taken at the doctor? Yet they can't find a reason why. Well, if you're new here, I'm Dr. Anthea Todd and I help women who are lost in the space between listen to their body differently. So when we get recurrent iron deficiency, we need to look at the possible reasons why. So how we do that is we put it through the fundamentals framework. So first, we think about medical. Well, why might you have low iron? And medically, we have to make sure that there isn't anything sinister going on. So are you losing blood? So do you have heavy menstrual cycles? Do you have something going on inside your guts that could be causing blood to leak? So bowel cancers, stomach ulcers, ulcerative colitis, Crohn's disease, malabsorption, those types of things. So typically, they're going to be looking at heavy periods and also putting a scope down your throat or up your bum to find possible causes. If that's not the case, they can't find any issue with your blood cells, then often we can be like, we don't know why, we'll give you an infusion, but then you have to keep going back. This is where we need to listen differently. We need to bring in the functional lens. And low iron isn't just about are you losing too much blood, and it's not just about are you getting enough in. We have to think about all the components. So one, yes, are you getting enough iron and you're not losing too much? Two, can you actually absorb it? So what's actually going on with your gut function? Three, can you utilize it? What's happening with your zinc, your copper, your vitamin C, your manganese, all of these other nutrients? And number four, can you actually excrete properly? Because if those pathways aren't working well, then our iron can often be a recurrent issue. To make it really simple and easy, how we care for that is we look at your four fundamentals, which is your nervous system, metabolism, nutrients, and blood sugars. When they're balanced, often recurrent iron issues can fall away. And then lastly, we can put it through the energetic lens. And when we think about iron deficiency, think about it fueling and giving oxygen and energy to our blood cells. So think about what feels parasitic in your life. What might be draining your energy? Pay attention to that, and if you can, get rid of it out of your life and see what happens with your iron levels. And remember, if you're noticing that you have symptoms that you don't quite understand, put it through that fundamentals framework. Medical, get checked. If there's nothing going on, then you're lost in the space between. Then you look at your functional, which is your nervous system, metabolism, nutrients, and blood sugars. And then finally, ask your body, what is going on? What are you trying to tell me about my life that I need to look at? And if you want to learn more and really truly understand how to listen to your body differently, follow along for more.